Singapore's Ministry of Health announced on 30th November 2024 that HIV self-testing kits will be available at selected retail pharmacies starting January 2025. This initiative aims to increase access to HIV testing and encourage regular screenings, particularly among high-risk groups. The announcement coincided with World AIDS Day on 1st December and was highlighted at the Singapore AIDS Conference held on Saturday. Senior Minister of State for Health Dr. Janil Puthucheary addressed the audience, noting the importance of expanding access to self-testing kits as part of efforts to combat late-stage HIV diagnoses. HIV self-testing is a quick and convenient way to learn one's HIV status, the MOH stated in its press release. According to MOH, the self-testing kits allow individuals to test privately at home by collecting an oral specimen with a swab. Results are available within 20 to 40 minutes. MOH highlighted concerning statistics about late-stage diagnoses in Singapore. In 2023, 52% of newly diagnosed HIV cases were detected at a late stage, mirroring 51% in 2022 and 62% in 2021. The ministry emphasized the importance of early detection, noting that self-testing kits could help address the gap by encouraging those hesitant to visit clinics to test at home. The data also showed that self-initiated testing accounted for just 15% of cases diagnosed in 2023. Regular testing, particularly among individuals with high-risk sexual behaviors, is critical for early detection and treatment. MOH recommends testing every 3 to 6 months for those at higher risk. The Action for AIDS Community Blueprint Midpoint Report, released on the same day as MOH's announcement, complements these efforts by underscoring the critical role of HIV self-testing in closing gaps in voluntary testing. The report highlights that stigma, fear of discrimination, and a perceived lack of risk are key barriers preventing certain groups, especially heterosexual men, from seeking testing. Self-testing offers privacy and autonomy, making it an attractive option for those hesitant to visit clinics. The report notes that during a pilot phase, clients who purchased self-test kits were more likely to be older, heterosexual, and first-time testers compared to those using on-site testing options. These findings reinforce MOH's strategy to expand access to self-testing through pharmacies. The report also warns that late-stage diagnoses have remained steady at 50 to 53% annually for decades, disproportionately affecting heterosexual men. Accelerating the rollout of self-testing kits in non-clinical settings, such as retail pharmacies, is seen as a critical step in reducing these numbers. Additionally, AFA highlights the importance of fostering a stigma-free environment around HIV testing, advocating for community-driven and government-supported interventions to normalize testing and engage at-risk populations. The upcoming retail launch builds on a pilot program started in August 2022 by the Department of Sexually Transmitted Infections Control Clinic and Action for AIDS. The pilot demonstrated that self-testing kits were effective, safe, and widely accepted, particularly among first-time testers. While self-testing kits provide a convenient screening option, MOH reminded users that results are preliminary. Positive results must be confirmed at a healthcare facility, as recent exposure to HIV may not yet be detectable. The initiative aligns Singapore with international best practices. The World Health Organization recognizes self-testing as a critical strategy for reaching populations that may avoid traditional healthcare settings due to stigma or other barriers. HIV self-testing is part of a comprehensive approach to ensure that individuals are empowered to know their status and take the necessary steps to protect their health and the health of others. The MOH release stated, "Expanding access to self-testing kits is part of Singapore's broader commitment to eliminating HIV transmission by 2030. This effort aligns with the global UNAIDS 95-95-95 targets, which aim for 95% of people living with HIV to know their status 95% of diagnosed individuals to receive treatment and 95% of those treated to achieve viral suppression. MOH's data showed that 209 new HIV cases were reported among Singapore citizens and permanent residents in 2023, slightly higher than 202 in 2022, but still the lowest annual figure since 1998. Increasing the proportion of cases detected early remains a priority. MOH noted that privacy and convenience are key factors in encouraging regular testing. By making the kits available at pharmacies, the ministry hopes to remove barriers like stigma and inconvenience that may deter some individuals. Retail pharmacies offering the kits will be listed in MOH's resources, alongside clinics providing additional support. Priced at around 22 Singapore dollars, the self-testing kits aim to be an affordable and accessible tool for individuals to manage their sexual health discreetly. As Singapore commemorates World AIDS Day, the launch of self-testing kits marks another step forward in public health efforts to encourage early detection and reduce late-stage diagnoses.